Good morning, ma'am. My name is Nicole Gaspi Sasaluya. Today, I am going to perform the suctioning. So, suctioning is the aspiration of secretion from the catheter. So, the purpose of this is to remove the secretion, to facilitate ventilation, to obtain secretion for diagnostic procedure, and to prevent the infection. So, the equipments I will be needing is the suction catheter, suction machine, connecting tubing, towel, stethoscope, two sterile gloves, two sterile basin, NSS solution or sterile water, and then the pulse oximeter. So, for the first procedures, we need to verify the doctor's order for the size of the catheter, types of solution, airway to be suctioned, and the pressure to be used. Then now we are here in the patient's room. Then next, we need to introduce ourselves, verify the client's identity, and explain the procedure. So, good morning, ma'am. My name is Nicole Gaspi Sasaluya. May I please verify your identity? Kindly state your complete name, age, and birthday. Okay, ma'am. So today, ma'am, I am going to perform the suctioning. So the purpose of this is to reduce your secretion and to prevent the infection. So this procedure, ma'am, is slightly uncomfortable but painless. So I will be needing your cooperation. Is that okay with you?
Yes.
Okay, thank you, ma'am. Next, we need to assess for the suctioning. So we are going to auscultate for the gurgling respiration, restless, vomitus in mouth, and the jolly. Then next, we are going to assess the patency of nares. Check natin yung ilong kung gaano kalaki, kaliit, at kung may nakabara. Then next, we are going to perform hand hygiene. Then, let's assume that I already closed the door and the curtain for the client's comfort and privacy. Then, we are going to put a towel. Then, we are going to monitor the oxygen saturation of the patient and also the pulse rate using the pulse oximeter. Okay, next, we are going to open the sterile equipment. So, it is already open. And then, we are going to indicate the date and time we open it. And we are going to put NSS solution or sterile water in the basin. Then open the test machine. Then test. Then next, we need to hyperoxygenate the patients. Ma'am, can you please inhale and exhale? Okay, thank you. Then we are now going to put the sterile gloves. So our dominant hand is for the sterile, and then for our non-dominant hand is for the non-sterile. So using our sterile gloves, we need to get the catheter. Then next, we are going to make a measurement. Then we are going to mark the catheter using our fingers. Then next, we are going to test the pressure using our sterile gloves. Okay. So, ma'am, can you please inhale deeply? Okay, thank you. Then next, we are going to lubricate the tip of the catheter. So let's assume that there's lubricate here. Okay. Ma'am, can you please inhale deeply? Okay, so let's measure the catheter at least 13 centimeter. Okay, ma'am, I am going to insert. Then rotate. Then flush. Then in another. Then let's assure that there's no secretion will left. Then next we are going to wipe the catheter to remove the secretions and then discard. Then ma'am, let me help you to wipe your nose. Then next we are going to suction the oropharyngeal. So let's assume that this is sterile. So we are going to measure for mouth to earlobe at least 10 to 15 centimeter. Okay. I-flash kami. Okay. Mama, I am going to start. Can you please inhale? Okay. So we need to rotate. So ma'am, I allowed you to deep breathly and to cough to move your secretion from the outer mouth to inner. So after that, the gum line. Okay. Then, if ever na may natirang secretions, pwede nating ulitin yon. Basta may interval na 20 to 30 seconds. So, after that, we are going to wipe the ano. Let's assume that this is sterile. Then, discard. So, remove. Then, we are going to discard. So we are going to assess the clients. And then after your mom, let me help you to wipe your mouth. Then we are going to dispose the equipment. We are going to assess the effectiveness of the suctioning. So, ma'am, how do you feel po? Ano pong nararamdaman niyo pagkatapos na ma-suction? Do you feel relief po? Okay. Thank you, ma'am. So, we are going to perform hand hygiene. Then last, we are going to document. We are going to document the characteristic of secretions, the duration of the suctioning, and we are going to teach the patients. So that's all.